This evening, we conclude our week-long special on the opioid epidemic in America. All of the segments can be viewed by logging on to foxnews.com/special report. Monday, we explained how we as a country arrived at this time and place where several dozen people die from opioid abuse each day. Tuesday, how the pharmaceutical industry fits into and may at times be fueling this crisis. Wednesday, the $80 billion a year cost of the opioid epidemic to the country. And yesterday, how the so-called dark web is making it easier for addicts to get hooked and possibly killed. Tonight, a look at some of the possible solutions. Chief Washington correspondent James Rosen is here with that part of the story. Good evening, James.
Brett, good evening. Throughout this series, we've made it a point to personalize these stories to show the direct human toll this crisis is taking. Tonight, in looking at possible solutions at both the federal and local level, we again do so through the lens of individual Americans, each playing a part in this still unfolding drama.
It started when I was about 16 years old. In my parents' medicine cabinet. I was in college at 18. I was stealing pills from a friend in a car accident. Turned to heroin and fentanyl. A friend came over and I was already addicted to pills, and the fentanyl was, I can't describe it in words. It was just amazing. The fentanyl was priced pretty high, and when I got outpriced, I turned to heroin.
It is the archetypal American addiction story of the 21st century, shared with Fox News by a patient at the Hills Treatment Center in Los Angeles, where the woman is enrolled in treatment for the 5th time and requested her identity be protected. By now, you know the numbers. 33,000 lives lost to opioid-related overdoses in 2015. On an average day like today, pharmacies across America will dispense more than 650,000 opioid prescriptions. Nearly 4,000 people will start using opioids inappropriately. Nearly 600 will turn to heroin, and nearly 80 people will die from an opioid-related overdose.
This American carnage stops right here.
On his path to the White House, Donald Trump promised he alone could, quote, straighten out the opioid crisis because career politicians, he said, would be beholden to lobbyists for the pharmaceutical industry. Last month, the president established a bipartisan commission on the opioid crisis aimed in part at improving access to treatment, something the federal government estimates 90% of those with a substance abuse problem are not receiving.
We know what solutions that, if implemented, would basically curtail and revert the opioid epidemic.
Since 2003, Dr. Nora Volkow has led the National Institute on Drug Abuse at the National Institutes of Health, or NIH. She urges President Trump and his commission to marshal the resources that she says she knows will turn the crisis around. More funds for treatment and better education for doctors, who Volkow says have been slow to realize the assumptions embedded in and the consequences that have flowed from their handling of their patients.
Addiction is stigmatized, and so the whole sense in many individuals is still that this is a behavioral choice as opposed to a disease where the pathology actually affects the areas of the brain that allow you to self-regulate. So it's like driving a car with no brakes. Some advances have been made.
This is life-saving.
A forensic chemist at the Drug Enforcement Agency showed us an injectable form of naloxone, a medication that, if administered in time, can save someone in the midst of an overdose.
So basically, you take this off and administer it very similar to an EpiPen. And basically, it blocks all of the opioid receptors in the brain.
Similarly, a program in Hamilton County, Ohio, where counselors meet with victims within hours of an overdose, has reportedly achieved an 80% success rate in keeping them in treatment. To prevent overdoses, one expert proposes improving record-keeping programs that chronicle patients' drug histories.
One of the issues with that, though, is they are run by individual states, so there's no federal standardization. So it's not a foolproof system, but it's a very powerful tool.
Dr. Howard Samuels, a clinical therapist and CEO at the Hills Treatment Center in L.A., which he founded, is himself a former heroin addict, now clean 32 years. He cautioned that even success stories like his are forever works in progress.
I've been locked up 3 years in treatment centers. 3 years, okay, until I finally got it at 32. Does that mean I was a failure? No. That means I was in the process of recovery. That's the key. the process of recovery.
As for the silhouetted woman we introduced you to at the top, she says she is benefiting this time from a sense of desperation she didn't have in the past, and that Dr. Samuels' center in Los Angeles provides her with something critical, Brett, a community of like-minded people who are embarked on the same journey.
Big story. James, thank you.